So the topic given to me today is about how nurses, if they are empowered, can make a difference in the clinical outcome. The healthcare organizations are trying to improve targets on quality, cost, and that is a measure of outcome they look for. When we see in patient perspective, I'm sure all of us would have been as a patient at some time or other. What do we see? We want a cure, quality of living, and of course, the cost to be very minimum and affordable. Let us see what does literature say. According to the IHI, they focus on three important aspects like improve the patient experience of care, improve the health of populations in preventive and rehabilitative services, reduce the per capita cost of health, and the fourth one depends upon the organization. So what is that? It is to reduce clinician and staff burnout. So when we focus on all four, we are able to make a difference in and impact the clinical outcome. Now let us see how the star rating of the hospitals happen. There are many models, but I have just presented one which has got mortality, safety of care, readmission, patient experience, effectiveness of care, timeliness of care, and effective use of medical and other services. But for all doctors and nurses, I'm sure we would not be able to achieve it. However, it shall excel certainly when nurses take full partnership with the doctors. So this is the theme of the presentation that I'm presenting before you. When we define empowerment, I have seen a lot of literatures on definition, book informations, but in my reality practice, what I could define it is in just three different words, which is power to act professionally. How many nurses are here? Can I see your hands? Please slip up your hands. Yes. Do you all feel when you're at the bedside, you have the power to act professionally? We will get varied answers. Many times, we do think we have to, but often it is not possible. We are being cornered. Sometimes we are not being empowered. So the factors are many. It could be internal, it could be external. Who to me be blamed? Both nurses, the internal environment, and out of nursing, the external environment. Empower has to be strategized. We have strategic plan in the organization. How many of our healthcare organizations have one component as nursing empowerment as a strategic plan? If it is not so, execution will not be done. So execution has to be very cautionally put forth because it is very difficult to have star doctors with us, better performing departments, highly qualified professionals in the organizations, and we have a good balance sheet also to follow and targets. So these are some of the things we have to have, but still, if we execute it with caution, I believe that we will be able to make the clinical outcome. Aggressiveness and assertiveness is one thing that we nursing community should understand. What is the definition of aggressiveness and the definition of assertiveness? Being assertive is always appreciable. Being aggressive will never take us forward towards achieving the clinical outcome. So this is my experience. I've got 32 years of experience in healthcare, and I have been deep diving into understanding what are some of the challenges today as a nursing head I would face or the healthcare is facing related to that. One is the decreasing resources. We have to understand no other way. We have to understand the resources are decreasing. Increasing demand. There is a great demand of manpower, demand of other aspects that is important. Third one, demanding care recipients. Patients demand huge. They want to pay less and they want to get 7-star care from the care providers. Less engaged care providers. How many of our care providers, the staffs who are working around me, feel that they own the department, own the hospital, own the work they do? Ownership. I think this is very, very important aspect. Recently, I was in a conference where a Singapore team was presenting just a concept of kindness. Kindness to the colleagues, kindness to patients, kindness to co-professionals. I think this is what is lacking. The fifth one is the diminishing creative ability of the professionals in delivering safe, quality patient care. I'm very happy that CAHO, AHPI, and such kind of conferences are kindling the creativity, and it is not enough. It is just the tip of the iceberg. Lot of kindling is important. So what is a strategy? Empowerment, what is a strategy? The main strategy I would like to place before you audience is the engagement. If you engage already well, please ignore. If you don't, reflect back and go back and see that it is in the strategy in the organization. Engaged nurses feel a sense of ownership, loyalty, and dedication to create a safer environment for patients and an effective and efficient work environment. This is one literature. I could present 100 literatures, but time is not enough for me to do that. Globally, it has been shown that when nurses are positioned in influence system practice and policies, it leads to improvement in quality of care, wellness, and reduce medical and clinical error. Again, I would like to re-emphasize saying medical and clinical error, both. Such positioning is important in India. We may talk on stages, nurses are empowered, but in reality, it is not. The reason, again, I would say, it is internal to nursing community and external to nursing community. No, both are to be blamed for it. This is a model that I have tried way back, and I think some of my colleagues are here who have tested these models in different hospitals. And this model helped me to understand and deep dive into various aspects in reality, how to push nurses into empowerment. Of course, clinical outcome is in the middle, and there are three important things that will help us to achieve. One in the professional perspective of a personnel, the other one is for the nursing profession, another one for the organization. However, I would like to now focus only on the pillars here. The first pillar is empowerment is a top-down power dissemination. Unless the organogram shows that the nursing leader is positioned well in the organization, things will not move. The nurses have to be strong. The nursing in charge in the ICU, when she goes with the doctors on the rounds, there should be a dialogue between the intensivist and the senior person. So each one of the pillar, if anybody is interested, can come back, and we have got a wonderful tool on this. It has got both independent and dependent role of nurses. Now, power to act professionally. I'll just skip through a few slides. It's only for your eyes and your thoughts. I'm not going to discuss much on it. First one is mortality. If I ask a question, if nurses can impact it, my answer is yes, and I can make it with my team. That is what I would assure to you. Second one is the safe care. And we are all aware of it. So many posters we are seeing here on many things. So yes, it is possible. The third aspect is the readmissions. Nurses can prevent a good preparation from day one, preparing them for discharge and on the day of discharge and follow up. Yes. Patient experience. CMC is known to be the best nursing care institution. I'm from CMC as an alumni. I'm proud of it. But I would say it's only because of the nursing care predominantly. And effectiveness of care, yes, of course, nurses can make a difference in healthcare. Timeliness of care, very important. One example in ER, doctors, delay in doctors' read. Now we have in Kaveri, which is called as an online monitoring of this. So we do it not mechanically, but online, and we are able to understand where is a gap and we fill it. This is a very important slide. I think the previous speaker as well spoke about it. The transparency and error reporting. Yes, we have to move towards the subjective occurrence monitoring to an online occurrence monitoring, which is like a triggers. IHI gives lot of triggers which can automatically get generated from the HMS. And that will give us lot of insight. Sometimes every day I get a dashboard where I can sit here and then see the so many kilometers away the hospital from the triggers, what is a functioning there. And these are some of the points that I would like to focus for the new age leaders in India. And the last point is like, if you want to have a fishing company, you need to have fish finders. So if you want to have a better clinical outcome, please, we have to nurse finders, the nurses, those who are passionate towards working for the clinical outcome. Excellence is a continuum, competing with self and not with others, and it's the way forward. These needs clarity with present competitive and business promotions. Clinical nursing leadership is a measure with a defined set of key result areas. Clinical outcomes will show significant improvement only when nursing care outcomes influence clinical outcome, impact hospital revenue and consumption, and contain cost for patient, hospital, and payers. Nursing care needs benchmarking at national, state, and institution level. I think this is just not even started in India. Who is stopping us to measure, present, and embark? So let this conference give us a thought process, and I would say the keystone to build nursing leadership is in the hands of all of us, and I think we have to move forward. Clinical nurses impact positive work environment, financial and clinical outcome. So I would like to again make this statement as a slogan: power to act professionally is equivalent to empowering nurses. That will result in clinical outcome. Transformation is required. We are transforming, and it is good to see every organization is getting transformed. And thanks to all the CEO and the top management and the co-professionals, medical professionals and others, those who are supporting nursing to move forward. Paths to make a difference, road not taken so far. Yes, empowering nurses to make a clinical outcome is, of course, not a road taken so far. Nursing has taken many roads in its travel as a profession, some less owned than other, even struggling to look ahead as far as possible for paths leading to fulfillment of its mission and goal. It's high time for us to realize empowering nurses is a high-intensity need. High-intensity need calls for immediate attention of policymakers, top management, and nursing leadership. Recommendation to 5th edition NABH, Empower to Act Professionally. Thank you very much.